I'm Dr. Matthew Morris with Rudimentary Health, and today I want to talk to you about everyone's favorite topic, medical trials. I think this one is actually very interesting, pretty cool name, ischemia, and it is something that you can actually put into use with yourself or maybe even your family members. Let's get started talking about it. Now, to be in this study, you had to have been found to have what's called moderate to severe ischemia. And basically what we're talking about is the blockage of one of these arteries. Historically, we have oftentimes taken patients in these situations and we have done a surgery on them called CABG. We basically rehook the vessels up so that you go around that area that's blocked off. Okay, so that's called a CABG, or a coronary artery bypass grafting. The other option is called stents. And so a stent, they go in through one of your arteries, it could be through your wrist or through your leg, and they open up a device and allows blood to flow through more effectively. We thought this is a pretty good treatment. It makes sense. We're kind of restoring that blood flow, so we thought. And in this trial, when they took those patients with that moderate to severe ischemia, they put them into two separate groups. One group was the group that received the CABG, or the surgery, or the stent placement. The other group received appropriate medications, which included treatment for their cholesterol and their blood pressure. It also included something obviously it's very interesting and exciting to me, lifestyle changes, which includes nutritional lifestyle changes, exercise, stopping smoking. Well, it turns out that what happened wasn't exactly what people may expect. The patients who received the appropriate medications and lifestyle changes did just as well as the people who had undergone these more invasive surgeries and stent placement. That's extremely exciting. Obviously, I'm going to be on the biased end toward lifestyle change and these medications because, well, I have a kitchen in my clinic, so you could imagine that's kind of where my passion lies. And while we often don't like to think of the cost savings when it comes to healthcare, I do think it's something to think about because it can actually impact us financially. I looked at one study that showed that average cost of a CABG throughout the US can range anywhere from $44,000 up to $448,038. So if anything, that gives you a little idea of the financial benefit of these lifestyle changes that you can actually do on your own. Just a quick note, this was in patients who were not having heart attacks, okay? So if you're at that stage, someone's having a heart attack, you gotta go with the procedure. You just gotta get it done because that's really most of the time gonna be your best option. All right, so what is our take-home point from this ischemia trial? Well, technically, I think what we've learned is that when it comes to even treating severe blockages in most of the vessels of the heart, we can use medication and lifestyle change just as effectively as surgery and stent placement. I send patients for procedures, for surgeries, all those things, and I am extremely glad that they're there for my patients and for my family. But I really think that the future may be within things that are already within your own control, which is extremely exciting for me. I love teaching these kind of things that we do know about and seeing the outcome and results that patients have. I think that kind of sums it up for me for today. I think this is an extremely exciting trial. I think there's gonna probably be a lot more debate about this in the near future. All right, I hope you have a good rest of the week and look forward to seeing you again soon. Thank you, bye-bye. You can subscribe to the channel if you like as well. You just hit the red subscribe button and then I think you have to hit I don't know what you have to do exactly.